Yeah, can you briefly again summarize what you said on yesterday because you did such a great job. Some were not on yesterday about your global work in this fight against drug abuse.
My pleasure, Mayor.
Yes.
Um, let's see, I seem to have, there we go. Okay. So good morning. Actually, good morning. I guess it's good afternoon, everybody. It's good afternoon. It's a pleasure to be with you today. And I've been very happy to hear the different presentations because there's so much going on in today's world that needs to be addressed. And I'm honored that Mayor Ford has given me the opportunity to represent our group on this conference. So let me tell you first, I'll just very quickly, I am a 40-year New York City surgeon, born in Cuba, of Jewish religion, married to a Venezuelan Catholic woman.
All right.
Thank you, Mayor. Thank you, Mayor. And we have 4 kids. We have 2 grandchildren. And by that introduction, what I'm trying to say to you is I'm a normal guy.
All right.
What I consider normal, because I don't know in today's world, I don't know what normal is anymore, but I had to leave my country. I lost my country. I've immigrated. And so, obviously I've encountered a lot of things in my life, which has led to me wanting to do things for our communities, which is why as a doctor, I got involved in drug education and run a television program, which is called The Truth About, Time for Truth, because I feel there's too much untruth in our world and distresses me. So realizing all of these things and dealing with people all the time, I wondered, I said, you know what, with so many good people working to educate against drugs, why is it that it continues? And I know I'm talking to a very important group because you know the answer. And so what I want you to know is I sit here in front of you, that in front of you, you have an ally.
Okay.
You know, not because I'm saying it, but because you really do. And I realize that the world seems to be monopolized by a few. And so because of the honor of Mayor Ford and also my close friend, the Globetrotter, Robert Hunter, I'm here before you today, and I'm going to present to you the Truth About Drugs program.
Okay.
So I want to go back to when I was a kid, and I must have been about 8 years old. And I remember watching him on TV and listening to him. And I loved hearing him speak. And that's Martin Luther King, because he was a very simple man, but he had a very powerful message of a dream for humanity. And so in order to help that dream, we have to have a drug-free world. 90% of the shooters in the world are on drugs. And it really is distressing, realizing that drugs cause 90% of the shootings. You say to yourself, well, the police that are getting shot, the people who are shooting each other, if we reduce the drugs, we don't have to pass so much legislation and our cities will be safer. We'll have municipalities with more justice because the inhabitants and citizens will be drug-free. So they'll be lucid, they'll be coherent, they'll make good decisions. Because basically, people are social beings. All you have to do is fly into any city, and as you're landing in that city and you look down, you go, my God, somebody's being a baker, somebody's being a farmer, somebody's being a political leader, somebody's deciding to stay at home and raise their kids, and it's all happening. So, you know, when I go, I'm a regular man, I go to LA Fitness. And when I go to LA Fitness, you know, all the men and women in that LA Fitness are very product oriented. You say to yourself, why don't I see what supposedly is always going on in community and does go on. And so it opens our eyes. Why is it that we had 100,000 American deaths last year of drugs, when in the 10 years of Vietnam, we lost 56,000? So in 1 year, we doubled the amount of deaths from drugs. And we should be livid about it because drugs are destroying our communities. The United Nations in 2016 had a conference. And in that conference, it was stated by all the world leaders that the way we were going to solve drugs was by prevention and education. It wasn't going to be by incarceration or by the judicial system. It was going to be by education and prevention. And then it wasn't going to be a 5-minute fix. It was going to take time, and it was going to involve all of us because we all have children. We all have grandchildren. So we all have a vested interest in the world. The Foundation for Truth About Drugs program is a nonprofit program. And what it does is it doesn't force someone, it empowers someone with education. I want you to know that the education and the statistics in these booklets were qualified by John Redmond, who was a very well-known high-intensity drug trafficking agency official of the United States government. So the program is very well qualified. It's available free of charge at drugfreeworld.org. If you look in your cities and you look at the crime, if you look at the lack of employment or the problems with employment, if you're looking at improving the economy, if you're looking at the improving the safety and the adherence of the citizens to those regulations already passed, it doesn't take rocket science to realize that if a person is not lucid, they're going to make bad choices. And if a person has stress in their life and turns to drugs, and they don't have the truth about drugs because they think that drugs are okay because it's been popularized in movies, Scarface, because it's been popularized by shows showing that the trafficked have a nice car, a convertible, and he has whatever he has. Or if it's a woman trafficker, you don't want to be biased, and she has all she has. Well, then obviously we're sending the wrong message to our youth. And when they get stressed out, they're going to turn to drugs. And when they turn to drugs, they're going to be lost to us, and they're going to commit crime. They're going to drop out of school. They're going to become a statistic, and they're going to become one of the 100,000 that dies. Now, the program is based on something very important. Nobody likes to be lectured. So please don't take what I'm saying to you as a flow, as a lecture. It's not. I just get very emotional when I see kids dying. And, my office is like the United Nations. Bobby comes to see me, and he's always teasing me that, that it's like a United Nations in my office because that's the way I am. I don't see a color on someone. I'm a surgeon. We all bleed red. We all have pain. We all react the same to the Novocaine that I use. And I treat all my patients the same way. So basically, it's important to realize that if we educate our parents with the truth about drugs and they speak to their kids, 40% less drug abuse happens to those kids. If we educate those youth before they get to be 21 and they don't take drugs, less than 2% will ever take drugs the rest of their life, which means that your city will be that much safer for the rest of your future in that community. This program has been distributed all over the world in 26 languages. Tens of thousands of events have been done. 180 countries have been reached, including the African continent, where Drug Free World is actually very much in usage by many different countries. And it's unfortunate and it's unjust. And I'm speaking to the choir when I say this, but that obviously the drug abuse and the drug devastation happens more in disadvantaged communities. So I don't have to go over that with you. You know that already. But the problem is that we need to do something effective about it. And as a surgeon, if I'm doing surgery and it doesn't work, I realize something. I've got to change what I'm doing. Otherwise, my patients are going to keep not healing. It's obvious that our programs have not worked up to now.
Okay.
If they haven't worked, let's do something that works. This program actually achieved a 19% reduction in teenage drug abuse in metro New York City area when we implemented it. We implemented it with NYPD school safety, whose director, Louise Johnson, loves the program. Why does she love the program? Because unfortunately, she has had things in her family with people that she lost. And she said some things that I can't say in this conference, which were very poignant and very to the point. Drugs are associated with the adverse mental health we're trying to solve. But why are we going to put these people on methadone? Is that a solution to someone who's already stressed out? Why don't we just give them a bottle of whiskey and tell them to drink? I don't think that's a solution. I think a solution is education. I don't see any human being who doesn't want to do better and be educated and know more and change their lives. And I'm talking to the people who can do all of this, so I'm very honored to be here with you. It's not that they're unwilling, it's that they need to have a chance. They need to be educated in a program that really works. It's in 26 languages, it's all over the world, that doesn't have a commercial interest, because Drug Free World is a nonprofit program. Okay. If they don't understand what drugs are, they're going to turn to drugs. So our purpose is to get to them before the drug dealers do. When they die, or if they die, the amount of devastation that occurs is tremendous. Because if you think about the sorrow that a family has when they lose their child, they're losing their future. It doesn't matter if it's 1%, 2%, 15%. You lose your child, it's 100% or more. You're devastated for the rest of your life. So we need to do something about this if we're going to change our country. If we're going to change the world. The program has public service announcements. It has educational booklets on every drug. Mr. Hunter and I have brought it to the Super Bowls. I want to thank again Mr. Hunter. I don't know if he's going to get a chance to speak. I called him before and told him, Bobby, you got to get on the conference, because he always is to the point. And Bobby said something, and it says something at every conference, and that really, to me, hits home to me. He goes, this is World War III. And we need to wake up that we're in World War III. And that this program brings education to our kids. And when you think about it, because we're dealing with our kids, I don't think there's any creed. I don't think there's any religion. I don't think there's any race on the planet that wants their kids to die of drugs or become addicted. With that, what I'm saying is this program can bring unity and bring the justice that we're seeking, because what it does, it unites us on something called children, our youth, our families, something that we're willing to fight for. And when we get united, something interesting happens. When we unite, we can see who is against us. And anyone that's for drugs, and I'm a doctor, and I use antibiotics, and sometimes I have to give my patients a little bit Vicodin, but it's very regulated. I try to get them on Motrin and not to have them take that. But as a doctor, I realize the drugs are not the answer. I have to teach them how to brush their teeth, how to floss their teeth, how to get a cleaning. If I want to just make a lot of money, sure, I'll put them on drugs, sedate them, do a procedure on them, make a lot of money, and they'll come back 5 years later with more tooth loss and very economically profitable.
Okay.
So anyway, I don't want to keep going on and on. I think I've made my point. The program is available to you.
Okay, and we want it. Excusez-moi, s'il vous plaît, Doc. We do want it, and from this point on, we are officially adopting your program as a part of the World Conference of Mayors. We want to promote it in all of our cities around the world, in Haiti, in Trinidad, in South America, across Africa. So we are teamed up. We're united, okay?